Hello again, welcome to another Upgrade Your OET Learnuary quiz. It's day 12, and for those of you who don't know what this is all about, I'm challenging you to watch one of my videos every day in February as part of the OET Learnuary challenge. Because I'm sure if you do, you'll be able to improve your skills and learn new knowledge to help you along with your OET journey. I'm a premium preparation provider of the OET and my name is Sona. Okay, so today's quiz is all about OET speaking and in particular giving advice. Now, yesterday we listened to a GP giving his patients some advice about varicose veins. We're going to carry on listening to that story, but before we do, and before we hear how a GP explains how to treat varicose veins, I want you to have a little think. How can you warn your patient that there are no particular medical interventions that are recommended here and there's no cure as such? So maybe your patient is expecting something that they can just take and they'll get better, but there isn't anything like that available to them. So how can you warn a patient that this is the case? Let's listen and find out.
So really, treatment-wise, I'm not going to give you any easy answers.
So here you can see that the doctor has warned the patient. So really, treatment-wise, I'm not going to give you any easy answers. So this really acts as a bit of a warning. This is the indicator as to what he's going to be discussing. And then here is the thing. There are no easy answers. So how can you advise your patient to wear stockings? What do you think you could say? So there's no medical intervention that's recommended. It's just simple, wear stockings. How can you tell your patient to do that?
So shall we leave it as it is at the moment?
Wear stockings.
Okay.
So just a nice firm pair of stockings. Do they go above the knee level, or is it just on the lower part?
Normally my socks are about that level.
So just get yourself knee-length socks, but a firm pair of socks which are actually helping hold things together.
Okay.
And in this case, the doctor is quite direct with the patient. He warns him that there's no real, nothing easy to do apart from wear stockings. And then he just tells them, wear stockings. And he reconfirms this, he reiterates it. Just a nice pair of stockings and they should be firm. He checks what the patient is wearing at the moment and the patient's just wearing normal socks. So he says, just get yourself knee-length socks, but make sure that they're a firm pair, which are holding things together. You can see there's lots of use of just, which softens the impact of what he's saying. And another question for you. How can you encourage your patient to try your recommendation? So it's maybe a little bit wacky. The patient thinks, what's the doctor talking about? He wants me to wear stockings. How can you encourage the patient to do that and reassure them that, if things get bad, they can come back? What do you think you could say? Let's have a listen.
But I think if it's getting from bad to worse, come back and see me.
Yeah.
But try the stockings first. So
I'll try that and then we'll take it further from there. So.
Give it 3-6 months.
So you can see here that the doctor says that reassurance, if it's getting from bad to worse, it's bad at the moment, but if it gets worse, then come back. And the patient is like saying, okay, and the doctor says, well, try the stockings first. And then the patient's still a little bit reluctant and says, we'll take it further then if this doesn't work. And the doctor says, yes, that's fine, but, give it some time for it to work. Give it 3 to 6 months. Okay, let's see what you can remember then. Can you complete the gaps? How did you get along? Let's listen once more, but this time with the answers.
So really, treatment-wise, I'm not going to give you any easy answers.
So shall we leave it as it is at the moment?
Wear stockings.
Okay.
So just a nice firm pair of stockings. Do they go above the knee level, or is it just on the lower part?
Normally my socks are about that level.
So just get yourself knee-length socks, but a firm pair of socks which are actually helping hold things together.
Okay.
But I think if it's getting from bad to worse, come back and see me.
Yeah.
But try the stockings first. So
Yeah, I'll try that, and then we'll take it further from there. So
give it 3-6 months.
Okay, well, I hope you found that useful. Thanks very much for joining us. Don't forget to tell all your friends and colleagues about this and get them to join in with the OET Learnuary challenge as well. And I hope to see you next time, tomorrow, hopefully, or if you're watching this later, just, go back and watch the other videos too and catch up quickly. Okay, see you next time. Take care. Bye-bye.